And you have an interesting story in this documentary, like this lady that was married to a man that he had cancer, and now she has cancer, and now she is struggling to pay for their treatment, right?
Yes, her story is very interesting. Her mother had cancer before her, and she discovered this cancer support group, which is a nonprofit. Then she met her husband. He passed, her mom passed, and she was diagnosed. She's quite young. I can't remember her age, but she's around 30. And she's a fighter. And she told me, I want to tell my story. Please, I want to speak. It wasn't, what we think.
Didn't go to
she's
her.
in
She
debt.
came to you.
Exactly. Well, she didn't come to me, but it didn't take convincing.
Hello and welcome to the second part of an episode of Talk Latin America. First of all, I got to introduce Michelle Mariño, who is our Latin America correspondent at our CGTN desk here in DC.
And he's Diego Laje, our correspondent in
DC?
DC.
Yes, as well. We're both in the same city. This is the second part of the conversation we had with Monica Villamizar, a Colombian-American filmmaker. She has earned as 3 Emmys. She's covered wars, epidemics, and cartels. And we're going to talk about, or at least we're going to start talking about, her documentary Triage, which exposes several deep-rooted aspects of the U.S. health system. So, Monica, welcome back.
Thank you. Thank you for having me again.
Thank you.
Monica, you got on a bus and you drove through several parts of the U.S. Trying to understand how people who don't get health get health.
Absolutely. I mean, it was a bit more complicated than that.
I'm a reporter. I tend to make everything into a headline.
Yes, that's a good headline. But what's behind the headline, I guess, is that we heard about a health fair. Have you guys heard of health fairs?
Yes.
It's very interesting. It's an event where a lot of doctors and dentists give up some of their time as volunteers. It's a pretty amazing thing. And they go and set up a massive improvised clinic at a stadium or somewhere public or somewhere, like a community type of center. And everybody from rural areas can come and get free treatment. You can get free MRIs, free lung scans, but you can also get your teeth seen and dentures and you name it. So when we heard about this, we thought this is really interesting. And we talked to the Virginia Dental Association and the Health Wagon, who are 2 ladies, Teresa and Paula, who do an amazing job of bringing health precisely to remote locations. And they were like, yes, come and document it. We are very interested that you're interested. So that's how this idea started.
And then it moved on to a full-scale documentary. And you spent time with them.
I did. I spent a lot of time with them.
What did you learn?
Many things. I guess the first sort of background to all of this is we wanted to explore, my team, who are the uninsured in America and who are the underinsured. I don't know if you guys had heard about that. There's a whole category. I think about 90 million people in the U.S. It's a lot of people are underinsured. It means you can have insurance. I can have insurance. But if we fall very ill, we might go bankrupt or we might face financial instability. But that is all numbers and it's all statistics. And I was like, I want to see the faces behind that. Who are these people? What are they sick? How old are they? What choices do they have to make every day?
People?
Well, like I said, there's around 90 million of them. So we try to meet a lot of them, interview a lot of them, and then obviously...
and what do they have in common?
What they have in common is they're all very resilient. People that I admire a lot. They're all fighters. People who want to talk to you normally, because we come here with big cameras, as you guys know, is because they want to share their story, because they think it will make a difference. It will inspire others. You have to have a motivation to speak on camera to someone about something so intimate. So these people, what they have in common is that they're fighters and that they want to fight the disease or the illness and get on the other side.
And you have an interesting story in this documentary, like this lady that was married to a man that he had cancer, and now she has cancer, and now she's struggling to pay for their treatment, right?
Yes, I really admire her. Her story is very interesting. Her mother had cancer before her, and she discovered this cancer support group, which is a nonprofit. It's just community people helping each other. It's managed by Karen, who's an amazing oncology nurse, who's volunteering her time again. And she shares resources because, just a parenthesis, the system is very complicated, but there's a lot of grants and there's a lot of money there that you can apply to sort of meet your needs. But then navigating this whole system becomes very difficult, especially when you're ill, especially when you're struggling to pay bills and to keep trying to get better and trying to work and trying to sleep well and eat well, etc. It's all sort of compounding. So Amanda had started going to this group. Then she met her husband. He passed. Her mom passed, and she was diagnosed. She's quite young. I can't remember her age, but she's around 30. And she's a fighter. And she told me, I want to tell my story. Please, I want to speak. It wasn't, what we
You
think.
didn't
Like,
go to
she's
her.
in debt.
She came to you.
exactly. Well, she didn't come to me, but it didn't take convincing. You know how sometimes you really have to explain to people. She was like, no, look, I get it. If it can help, I'm all for it. And she's very public about it.
And she's in debt right now.
Very much so. And she said a very interesting thing to me. She said, I can pay all the bills, but if I'm dead, who cares that I would have paid all my bills? I want to stay alive. That's the most important for me, is every day I wake up and it's staying alive. And I find that very admirable and very brave. Yeah. So, again, like I really liked being with her. I learned a lot from her. She's dealt with something very intimate in a very open way. And I thought that was very interesting too. So she posts a lot about her illness on socials every day. And she says, it's because I don't want to update people and I don't want people to feel sympathy for me. A very interesting and I think a very good approach to a very stigmatized illness in a way, because when you have cancer, people think they treat you differently, or they think maybe if they're your employer, they're worried about your performance, and all kinds of negative things are attached to this. But she wants to like destigmatize.
And what did you discover about cancer treatment in the U.S.? Because before we started recording, you were telling us about the cost of chemotherapy. And I was like, oh my God, I didn't know that was that high.
So it's an interesting question, because I think, first of all, the U.S. has the best cancer treatment in the world. People from all over the world come here to get treated. There is, for instance, MD Anderson Hospital in Texas that's world famous, and they have an international wing. They have so many patients. It's the best treatment, but it's extremely expensive. Sometimes chemotherapy can be $30,000. If you stop to think, the minimum wage in America is around $40,000. So you're talking one session of chemo, which is not necessarily enough to get you better, is $30,000 already. Then there's all kinds of alternative or different therapies, like proton therapy. That's $20,000. We met someone who was given 15 sessions. So if you do the math, 20,000 times 15, it starts getting extremely expensive. And your insurance may cover it, it may not. Then it's where things get very complicated. It depends on the insurance you have, it depends on the copays, it depends on many things, and how much you're going to get reimbursed and how much you're going to have to front out of pocket. And you're basically at the mercy of your insurance company. I'm praying that it's a good one that will cover all of this, because even if you're a millionaire, this money will go fast.
Yeah.
Very fast.
And sorry.
No, go ahead.
No, you.
You were very close to these people, right? Because for them to tell you a story, like their personal story, you have to be very close. I mean, as a journalist, you try to not be involved, like, right? But did you cry
Yes, I cried. I think I cried a few times. I mean, I love people and I really empathize with them. And I think my empathy it's very real. And I think maybe they can tell and they want to tell me more, or maybe it doesn't have it. I have no idea. But I really felt I felt their pain sometimes, and I felt their despair. Um
Did
the
your guests ever see you cry? Or you do it
I don't
privately?
know. I don't remember. I don't hide anything. I'm very open. I'm not like hiding and crying or anything like that. I'm very upfront. But I think there was this one lady um, who said, I'd rather die than be a burden on my family, because, the problem here is that if you die and you have medical debt, it gets inherited by the people who survive you. So you might die and you might bankrupt your spouse or your children, and that is a very serious thing. And I just thought, we don't realize and we don't think about the consequences, that it just can affect generations in a way, and that's unfair.
And especially I don't know if you ever heard this, but once I was in here in Washington D.C. and there was a traffic accident, and the person that was, that was there, laying down, he started yelling, "Please don't call the ambulance!
Exactly.
Don't call the ambulance! I
Because
don't have money.
it's probably
I
going to
don't
cost
have money."
$5,000. Exactly. Something like that. That's what an ambulance transfer could cost. And I'm saying it's the only system in the world. And I don't know if you guys have, well, I guess other systems in the world are like that too. But I found it very perplexing that you go somewhere and you ask, how much is this going to cost? And they cannot give you an answer, because there's so many factors involved, so many variables involved. It's very hard to know how much a treatment or a lab or something's going to cost. And if you have some a medicine that you have to take for the rest of your life, it may change price. And you know what? It may increase twice or 3 times or 30 times. There's drugs that have increased 30-fold or more. So it's very unpredictable. And I find that very unsettling. And it must be very stressful for people who are depending on these. Yeah.
At the same time, you were born and raised in Colombia.
I was born here. I was born in America.
Oh, okay. But you have a very strong link to Colombia and Latin America.
Absolutely.
How would you compare the systems?
I mean, I don't think there's a comparison. I mean, Colombia is a poor country. It's a lot worse. Health there is obviously a lot worse. But what I was interested in is, well, first of all, I'm interested in America because I am American, but it's also a Western country, and it's a rich country, quote unquote. So you would think that health would be more affordable, and yet it's not. Again, the best health in the world can also be obtained here. And if you're very rich, you're going to
If you
get
have
treated very
money,
well.
yeah.
And if you're very poor, you'll have very good health. It's the people in
Exactly.
the middle. It's the middle class that gets mostly affected. And I think the middle class is what pushes a country. So it's unfair on the middle class. And I think it's unfair on me personally. I was affected by this story because health care here is given by an employer. And I am self-employed. I have my own company. So my healthcare coverage, my insurance, is never going to be as good as if I was employed by
So you're
someone.
underinsured.
I'm totally underinsured. If I get seriously ill, my plan is to get on a plane and go to South America and get treatment there, because I couldn't afford it here.
Yeah, that was where I was going.
Yeah.
Can you expand on that?
I mean, it's something that came from World War II, I think, where
No,
they
expand
started.
on the idea that you get on a plane and you go to South America, leaving behind the best care in the world at the same time.
Absolutely, because I can't participate in the best care in the world because I'm not employed, because I am a freelancer. So as someone who is not attached to a job or an employer who's going to pay for my insurance, I couldn't afford an operation. I mean, I guess I could, but I think it would be too expensive. I think it would make a dent on my finances. So I would, plus a lot of my family are doctors, so I think I would, just feel more comfortable in general. But I think it's a burden of the middle class. I think if you have Medicaid is the sort of welfare government system. Medicaid and Medicare for those over 65, and Medicaid is for those who are poor. And that covers you pretty well for catastrophic events, for instance, what they call a catastrophic event. If you're rich, well, you're rich, and then whatever, you don't have a lot of problems.
You have rich aid.
Exactly. So you can pay out of pocket. But if you're, it's the middle class that gets squeezed. And this is not something rare. I mean, this is a problem in many countries in the world. But I was just more interested about the US because it's sort of the paradox, right? How can they have these amazing technological advances? I mean, the vaccines are all discovered here, all the best cures and treatments. And I mean, American hospitals are really amazing. I can say because I've filmed inside of them, and it's something like you've never seen. Pristine technology. I mean, it's just mind-blowing.
But prevention is not something that they
Absolutely.
invest
And you've said
here,
something
right?
really important. It's not, prevention is the key. It's a public health thing. If you don't make sure that all of your population or a big part of them are healthy, then you're going to pay the consequences later when they all have serious problems.
And even what kids eat at school.
Absolutely.
Right?
But
wait,
it's
how
a
do you
modern
see-
problem too.
Yeah.
I mean, it's not only here. We're eating very bad food. We're eating, ultra processed things. We're very stressed. We don't sleep. We don't exercise, sedentary lives. And I could go on and on and on. All those things, make
So then
it.
how do you see initiatives like MAHA, Make America Healthy Again, where they want to get people into sports and so on in some aspects of it at least?
I mean, I'm not familiar with the whole thing, but I think getting into sports is great. Definitely. Everybody should exercise more, all of us. I mean, like I was telling you guys last time, I mean, I think I'm really fascinated by the mind and body, the human mind and body. I mean, if you see Olympic athletes and what they can do, if you see a ballerina and what they can do, it's absolutely amazing, like superhero stuff, right? But our bodies can also break very easily. They're very resilient, but they're also break very easily. And I think that line I'm very interested on. It's a thin line, and health is a precondition of having a happy life. You can have everything in the world, but if you're sick, you're not going to enjoy it. You're going to be miserable.
Yeah, it's what they say. You can have like 10 problems, but once you are sick, you just have one, right?
Exactly. And everything evolves around that. And I think regarding the documentary, and I invite people to watch it because I think it's very interesting, people will continue to work even if they're gravely ill, and they shouldn't, and they should give their body a rest, because if they don't work, they're not going to have insurance, and they're not going to be able to pay, and they're going to lose their car and their house. You know what I mean? So it's like a domino effect. It's very, very difficult. So it's what you said, it becomes a one problem, and all your life is going to evolve around that one problem. It's going to affect all of your relationships. And if you have family, they won't be able to work because they're going to have to take care of you, et cetera, et cetera, et cetera.
And
So
you
it's like a
inherit the
snowball.
debt. Yeah.
It's a snowball effect.
And I want to understand, after you've seen all this, after you went over and saw the tremendous differences, because if I understand you well, you're illustrating social differences through health, right?
Absolutely.
So how has it changed your view of the country, of society here? How has that evolved?
It hasn't really changed. I mean, I try not to be judgmental. I try to report from a place of objectivity. I think people can make their own conclusions. I mean, we live in an extremely unequal world, and it only takes to see Jeff Bezos and Elon Musk and the fortunes they're amassing to know inequality, and to see how some people struggle to make $1 or to eat or to get the basic food, and then some others are going to become, trillionaires. It's a very unequal society. I mean, I don't think it's anything particular to specific countries, but I think it's something that we should be aware of, and we should try to battle inequality. Absolutely. I mean, every problem in the world stems from inequality. If you stop to think, drug trafficking does too. I'm not making an apology for drug cartels, etc., but they come from a place of poverty where the only social mobility is through trafficking. It's the only way to get money or advance or get other opportunities. So, yeah, inequality in health, education. I mean, this should be basic rights, and sometimes they're not. But I think that's why journalists try to expose things, right? Like what's not working, what's not fair, ultimately. If that makes sense.
Michelle, I'm about to
You're
present the greatest inequality here.
Okay.
So I give you one last question.
No, it's
No?
okay. I think we are, yeah.
Yeah, so we're going to present a tremendous inequality.
okay.
And on that inequality note, I'm going to say, Monica, thank you very much. Great having you.
Thank you.
Thank you, guys. Always love talking to you. Please invite me again.
Yes, we will.
Yes.
And with this, and a big thank you to Monica Villamizar, we end this conversation of Talk Latin America. We'll meet again soon with Michelle Mariño, our CGTN Latin America desk goddess. In best producer, individual, and person who stays across all the news in the region.
And Diego Laje, our anchor in Washington, D.C., from Argentina.
Of course. That's the difference between good and perfect. We'll see you next time. Thank you for watching. Stay tuned. Bye.